Senator Ted Kennedy first devoted himself to reforming health care when he discovered Boston public housing residents had to spend 5 hours getting to and waiting for emergency room care. That was in 1966. 2 of his 3 children battled cancer. One, his son Edward Jr., lost a leg to it at the age of 12. In our fourth story tonight, the future of what Kennedy called the cause of his life, health care reform. The health of all Americans, especially those in need, preoccupied this Kennedy even before he entered the Senate.
No problem that we have here in Massachusetts is more important than providing medical care for our senior citizens. I believe that it is essential that we provide a medical care program which is financed under Social Security.
Last month, his committee passed his bill for reform, but Kennedy has been down this road before. Lost the battle when the Clintons tried in '94. Lost when he ran on it in 1980. Lost a battle with President Nixon over it. Last year, he played kingmaker, anointing a new standard bearer for the cause. And so it is reported that when this president has been asked why he pushes health care so hard, he responds, "I promised Teddy." We're joined tonight by Senator Bernie Sanders of Vermont. Great thanks for your time tonight, Senator, and our condolences on the loss of your colleague.
Thank you, Keith.
Meals on Wheels, AIDS research, other medical research, cancer research, nutrition programs for pregnant women and children, expanded insurance for the unemployed, occupational safety regulations. That's just the first few items on the list of things brought to this nation by Senator Kennedy. It is so long, it is hard to imagine that there is an American living today whose body, literally body, is not in better shape than it would have been were it not for this man, correct?
That is exactly right. I mean, among so many other things, pushing Medicare, pushing Medicaid, pushing children's health insurance, there are 18 million Americans today who have access to primary health care through community health centers. That program was developed by Senator Ted Kennedy.
Tell us about the bill that the Kennedy Committee passed and about his concept of health care reform and where it stands now in his absence.
Well, as you know, and I think all of the viewers know, Kennedy's passion was that every single American have health care as a right of citizenship. He understood that there was something lacking in our country today when we remain the only nation in the industrialized world that does not provide health care to all people, and yet we end up spending twice as much as any other country. Where we are right now is Senator Kennedy's committee, which was led by Chris Dodd in his absence, has passed a pretty strong health care bill, which, among other things, has a strong public option, which would substantially increase the number of community health centers in America so that all Americans, in fact, would have access to a doctor, to dental care, to low-cost prescription drugs, a greater emphasis, much greater emphasis on disease prevention and on quality care, and, of course, access for all Americans. That was passed by the Senate Health Committee. But as you also know, the Senate Finance Committee seems to be going nowhere in a hurry. My view, and I think many other people in the Senate think enough is enough. Let's take the Senate Health Committee bill. If no Republicans are prepared to support it, and I certainly hope that some of them will have a change of heart with Senator Kennedy's death, then we go it alone. We have 60 votes within the Senate, and we can defeat a Republican filibuster. We negotiate with the House, and we finally pass health care reform that this country has been waiting for decades.
To the point you just raised, Senator Kennedy wrote that incremental measures won't suffice anymore. Is there any chance that his passing will at least inspire wavering Democrats in the Senate and the so-called blue dogs in the House to stand fast for the kind of reform he was dedicated to?
Well, I certainly hope so. You know, with a Democratic president with 60 votes in the Senate and a strong vote in the House, it really is embarrassing if the Democrats can't pass strong health care reform. And what my view has been from the very beginning, if for whatever reason in the Senate there are some senators who don't want to support a public option, don't want strong health care reform, that's fine. At least vote to stop the Republican filibusters, which over and over again are holding up any kind of progress. And if they choose, the Democrats choose to vote, some of them, against final passage, that's fine. We will have 50 votes in any case to pass strong legislation.
I apologize if this last question seems at all indelicate, but Mr. Obama's reply, "I promised Teddy," will the president be able to deliver on that promise, or are we just going to end up with some sort of obscene bill, even if it's named after Senator Kennedy, that just funnels more money to the insurance companies?
Well, I think we have, all of us, those of us in Congress and the American people, have got to stand tall right now. We need strong grassroots effort. We need to put steel into the backs of many members of Congress to have the guts to stand up to the insurance companies, the drug companies, the people who make billions off of health care, and finally say that every person in this country is going to receive quality health care, and we're going to, in the process, save billions and billions of dollars. We can do it if we have the courage, and now is the time.
And now there is unintentionally inspiration. The independent Senator Bernie Sanders of Vermont, great thanks as ever, sir.